let me drive you straight into the arena for which I called you earlier for this interview. And that's about, and I know that it's so timely because Chimamanda Adichie's son's case is one too many, one would say. We've heard it, and a lot of people, is Chimamanda Adichie's son's case today. There are many, many more that have happened in the past years that people do not know about, or that is happening right now that people don't know about it. The famed Nigerian author, internationally acclaimed Nigerian author, accomplished in every sense, who has faced this very, very sad incident that has happened. And I'd like to get your view. You live in Lagos where that has happened. And some of the biggest hospitals in Lagos have been accused of this kind of negligence. She has alleged medical negligence. But in the case of Chimamanda Adichie's son, what exactly do you think played out?
Well, as you know, one has to be extremely careful because it's still in the state of allegation. So what has been said about this? But first of all, let me just give a small background. There is a complete medical, regulatory, and legal failure in the medical profession. Complete. All the systems are broken. The medical profession is suffering from lack of funding, the regulatory institutions, everything. The last law regulating the medical profession was passed in 1963. It's absolutely obsolete. That's part of the problem. But in this case, if what is alleged is true, what was administered to the young baby is such a powerful sedative that if wrongly administered can cause cardiorespiratory failure. So the essence of the sedative was to stabilize the child for a long journey. And if true, because as I said, one has to be extremely careful, we're at the stage of an allegation which has been made by no less a person than Chimamanda, but the hospital has also denied the allegation of medical malpractice. So the investigation that the government has launched will establish what's going on. The hospital, in fairness to them, in my long years of medical malpractice cases, is one of the very few, I must commend them for that has triggered an internal governance, check as to what went wrong. But what I would say to the hospital is they needed to have involved independent, people, the family, external medical people from the legal profession, to give authenticity and transparency to that process. But exactly what happened is simple. There is an alleged overdose of propanol. You remember the Michael Jackson case? It was exactly the same medication that was administered to Michael Jackson, but it was an overdose, and that caused them to have respiratory and cardiac arrest issues. So we'll wait and see what would play out. But I think beyond that, it's a bittersweet thing that it took Chimamanda's stature to call attention. I've done about 25 cases last year, I think. Even the famous case of Beju Oboma. Nobody cared about it. We were just on our own. Eventually we had a good decision from the coroner and the hospital was sold. So what Chimamanda's case has highlighted is what happens on a daily basis. It's just not Chimamanda's case. I, speaking to you, I've been a victim. My brother Nnamdi was also a victim. He had hernia, went to a physician, and the physician conducted an operation, what should be done by a surgeon, and he went into septic shock. So what I think this should teach us in Nigeria is the need for a new medical governance regime. The law is too old. It's over 63 years old, needs to change. We need a strong regulatory framework. The Medical, Dental, and Dental Council of Nigeria is too slow. They are the ones who do supervise medical malpractice, but they are not independent, mostly appointed by government, underfunded, very slow. Their results are not transparent, so nobody really is called to account. The other point would be for hospitals to be called into account, not just focusing on the doctors, but the doctors also have their own responsibility. The other point, I think, why this issue is underreported is that people are exasperated about taking it forward. They don't get compensation. The courts are too slow. When you go, you have to prove medical malpractice, which is such a difficult thing, unlike in the UK where the test is different. In the UK here, the test of proving that a doctor is negligent is that you have to prove malpractice. In the UK, you prove clinical incompetence. They are related, but clinical incompetence is far easier to establish than medical malpractice. So what I intend to do after this, because it's not enough to keep talk, I would be writing to the speaker, as I did in the case of Peju Boma, but maybe now that we have this new situation, reminding the speaker of the letter I wrote, I think 2 years ago, calling for a complete overhaul of the Health Act, of the health law of Lagos State. It is absolutely old and needs to be changed. But one important area that we need to look at would be in the area of clinical governance. Now, the last chief medical officer of Nigeria was the late Sir Samuel Manuel. I think he was in office in 1976. The job of clinical governance is to make sure hospitals run according to certain standards. Inspections take place, and you can be sure that the doctors are on their toes because they know that the clinical governance regime is at play. What has happened since that time is that the Health Act governing the Federation has empowered the minister to be the chief medical officer. That's not possible. The Lagos State Health Law has done the same. So you would not find a position for the chief medical officer, who actually is the person standing between the minister and the hospitals. His role or her role is making sure that the hospitals offer clinical care. That has been removed. And that's why you have everyday killings in hospitals. It's a killing field, and that has to stop. So right. Chimamanda's case, unfortunately, yes.
So, I mean, and I said earlier that I had a very good opportunity to be taught by a PhD law practitioner who is equally a medical consultant in his field of practice. Very rare in Nigeria. When I was studying law, he taught me medical law, medical and health law.
I think I know the guy.
Yeah. You know him well. He's the chief medical officer at the State House Clinic. He's a lawyer and a medical doctor who has risen to the highest levels in both at the first class and the law school, had distinctions in master's and PhD in both practices. So very interesting. And it was a very practical. I was particularly one of the most engaging students in the class because as an adult, I've seen so many issues. And on the health and medical law, there are issues of medical error, medical negligence, medical malpractices, unethical conduct. And there are very different aspects of all of this, which even in the doctor-patient relationship, there are a lot to consider. Unfortunately, in the Nigerian context, there are too many things that happen that professionally in elsewhere, some people might be going to prison because of some of those conduct. Consent. I mean, you heard about the case of how a medical doctor removed a patient's kidney without the patient's consent. How catheter has been wrongly positioned or wrongly administered such that it led to complication. We've heard about how a nurse, injected on the wrong part of the body, or on the muscle, which led to, I've seen situations where people have had to go and do surgery on their arm just because they were giving injection on the arm, and it led to skin disease, and it was deteriorating. These are grave issues. I mean, laws in Nigeria, we have them in abundance. Is it a case of the bodies of laws or a case of a systemic failure? What do you think we have more as a problem in Nigeria?
It's a combination of everything. which I call, governance. So if you have a particular sector, whether it's medical, oil and gas, and whatever, and you allow the people there to go unregulated, then you will have problems. Everything in the world requires supervision and compliance. There must be compliance, ethical standards. When these compliance measures are not in place, then it means that, for instance, for the doctor, no one is checking him. He can do what he likes, absolutely what he likes. If he conducts himself wrongly, who is there to supervise that misconduct? Nobody. Because as I said, one of the key functionaries in the medical system, the chief medical officer, is no longer as important in the scheme of things as they used to be in the 70s. So they are practicing on their own. I mean, there was a case I did. There was a horrible case that led to the death of the lady in question. The hospital just gathered a team of doctors. One came from Umuahia, arrived on Friday, performed surgery on Saturday, returned to Umuahia on Sunday, and the patient was dying of acute kidney injury. Where was the doctor? Under the ethical rules, you ought to see your patient after surgery within 24 hours. But he returned to Umuahia. And in the course of the coroner's inquest, the coroner asked, you took part in this operation and you disappeared you came from Umuahia and returned to Umuahia. How could you be effective? That's a big case of medical, negligence. But one has nobody to supervise these people.
Yeah.
So all these hospitals,
yeah. Yeah, I mean, and yes, it's important also that the understanding that there are two prongs to how a doctor-patient relationship should happen. One on the other, on one hand, is trust, to be guided by the law of trust. The other on the law of contract. As soon as a patient enters into the hospital, right, there is a contract that is established that you are supposed to do this and do that. Also, when you have administered, yes, you have done your own part. The trust from the patient that my life is secured and safe as I have submitted it to you.
Absolutely.
Yeah. So in the Chimamanda Adichie son's case and the case, Uboma case that you reference, at what point can a patient say, look, I've entered into a contract with this hospital, and now I trust this practitioner to be able to exercise his professional, in his professional capacity, deliver the best care for me.
Yeah. I mean, the point would be when the patient has the confidence, because generally we make that assumption. If I were to go to the hospital and the doctor said you needed to take an injection, I would not immediately begin to ask, are they competent to do it here? So there's a certain degree of trust. You hand over yourself to the care of the hospital. So it's a big duty on the part of the hospital to absolutely make sure that they can deliver quality care. But you need a quality care commission. In the UK, there's something called the QMC, the Quality Care Commission. Their job is to ensure that if you claim to be a hospital specializing in this field, you have everything. In the case of Bejubuma, the hospital ought to have had an ultrasound scan. They didn't have it for such a delicate operation they were conducting. And they were found absolutely liable. So this issue here, I think, ought to be a lesson to us all. It ought to be a lesson to the Nigerian government. It ought to be a lesson to, I mean, it's not enough for the Lagos State governor to have made, a broadcast. I mean, I commend him for that. But what will change is the issue. The child of Chimamanda must not be allowed to have died in vain. If it will lead to a complete reform of the medical system, then so be it. And that's what is required. We need to have a new Medicare system in Nigeria. That should be the way we should go forward, take this thing forward.
You have inferred in your piece that there is some level of lack of oversight, and that some hospitals just ride on without checks. And you have also raised questions about how aged our laws are and needs to be rapidly and consistently be checked and changed. And if you do a comparison,
Yes.
and I mean, a lot of people know in the United States, for example, issues of people are very careful. Hospitals are very careful because the bodies of law in their healthcare, in their healthcare, people get paid a lot of money for little things. But if you make a very good comparative analysis, sir, between the Nigerian healthcare system, the UK bodies of law, the South African system, and the United States system, we might be able to get a sense of how weak our systems are, how ineffective our laws are. For example, there are those who have accused or said that, look, you also mentioned inconsistency in the rulings that we have seen in the Nigerian laws. The long delays in the healthcare practitioner laws that we have seen. Doctors blamed individually. What happens in other client hospitals in the UK, for example, are legally liable also. In the Nigerian system, there's a weak clinical governance. There is a poor record system. There are electronic healthcare data system in other clients. How can we rapidly make this system change? For example, I imagine if Lagos State because Lagos always led in a lot of judicial and legal reforms. Can we start with Lagos, for example, in changing what has become a very concerning healthcare delivery legal system?
Yes, we can, because what we need to do is just to simply look at the Lagos healthcare, the health bill, the health act, and say to the Speaker of the House of Assembly, could we really have a public hearing about this law in view of all the killings? I mean, Chimamanda's own is big news, it's public, but I can assure you that in my own practice, we're dealing with one now where it's a lawyer who took the wife to deliver a baby in a hospital. I mean, a simple procedure. Baby died. Baby died. And that was it. We then said, okay, you know what? We are not happy with what has happened. Could we have what we're entitled to in law? The medical records. They said they won't give it to us. Because I've seen cases like the Obama case where once it's gone wrong, then they begin to doctor the records. They begin to doctor the records. I can even tell you a story about this doctoring thing. So I recently had a fire in my house. So I complained to the Eco Electricity Corporation. Look, the neutral in the wire coming into the house was energized, and therefore it sparked fire into the place. Could you take responsibility? They didn't. But they came thinking I wasn't clever enough to know what happened. They disconnected everything, thinking that I would not realize this. So there is a very important lesson here, and I use this as an example. We need to be very conscious when we even visit hospitals. I personally read my medical lab results very carefully, because sometimes when they think you don't know what the lab results say, they tell you something different. There was a lady, fortunately, she survived. The husband came along to see us, and high blood pressure was extremely high, and she went in. And a nurse, there was no doctor, said, no, madam, don't worry. We're going to give you an injection. And she was a bit taken aback. Injection for high blood pressure? This didn't seem normal. But she insisted, the nurse insisted, give her the injection, and she went into a state of shock. But luckily she survived. So I can go on and on and on. My brother had this hernia case I just mentioned, where he went to see a physician. Hernia is a little surgery that is operated on the left side. The physician cut him open. Unbelievable. A physician.
Yeah. It's so
cut
sad.
him open.
Yeah.
And
let's take a little break. We've had a colleague here who was misdiagnosed. And when he got out, he saw that whatever they were diagnosing him of in Nigeria was totally different from what was. Well, it was almost too late until he got out of this country. Yes. There are good hospitals, there are good doctors in Nigeria, but like you mentioned, the system is failing and people are dying. Will the government allow this to continue? The government is responsible to ensure that the system is rid of all of these unnecessary debts.